Hello, good evening, friends. We are back once again with the episode 18, and I am super excited to welcome the president of UICC, Dr.Anil D'Cruz, and eminent head and neck surgeon, cancer surgeon. Sir, first of all, let me bow down to you for giving with this incredible opportunity on this day about World No Cancer Day and to quick tobacco in every form.
Uh, Shrenik Bhai, thank you for having me on the program. As I tweeted this morning, you are really a crusader for cancer control, and I'm privileged to be part of your efforts. Thank you for having me over as well.
Thank you, sir. Thank you. Sir, there are two reasons I would like to share with you. Number one, I had the privilege of meeting you in Ahmedabad for less than 1 minute. That's number one. And I mean, yes, I had been operated by Dr. Gautam Patel, but giving me incredible support opportunity for more than 3 years. I admire and honestly speaking, I have found you as my role model. And this is the second time in 6 months. I am having a pleasure and privilege to welcome you on this platform. So thank you so very much for your very much valued time.
Thank you. A pleasure to be with you. It's an important day, and if we can discuss, speak, touch the lives, change the lives of many people who listen to us today, I think our time is worth spent. So once again, thank you for having me on your lovely program.
Thank you, sir. Give me a few minutes. I would like to give a bit introduction about you to the people so that they know you. I mean, sir, as a matter of fact, in oncology field across India or abroad, you really don't need any kind of introduction. But for the new entrants, it is quite necessary that people should be knowing much more about you. So, friends, Dr. Anil D'Cruz is president of UICC Union of International Cancer Control, and we should be very much proud that is controlling, navigating cancer control in 170 countries across the globe. So that is number one. Number two is incredible contribution, dedication as a head and neck cancer in India and abroad for more than 33 years. That is number two. And number three, he is considered as one of the most eminent head and neck cancer surgeon, especially for palliative care for recurrent head and neck cancer, and is involved with too many other organizations in India and abroad all around. And he currently is the head of the department in Oncology, Mumbai. On top of that, he is also giving the consultation services in Ahmedabad, Chennai, and Delhi. So once again, sir, very warm welcome to you, and it is really once again a huge privilege for me of conducting interview. So, sir, my first question is, as a president of UICC and India in an individual.
Hello, I seem to have lost Shrenik. Okay. I was wondering whether it is my end of the call, but I think it's his end. Ravi, if there are any questions that I could answer, if any of the people who have already logged in, if they're putting questions till Shrenik comes, I'll be happy to answer. Or I can just talk a little bit till he comes. Okay, so quickly, till Shrenik Bhai joins, and that's the problem with these virtual meetings. Someone always uses the net connection, and it's quite frustrating for people who are on. But I'll fill in till he comes back again. So very briefly, as Shrenik said, I wear two hats. I'm a clinician at heart. I'm a head and neck cancer surgeon. I've been doing this work for 30 odd years. In addition, I'm president of the Union International for Cancer Control, which is the largest NGO committed to the cause of cancer care, cancer control. And basically, to quickly tell you about UICC, there are three platforms of work. One is advocacy. And in advocacy, one of the strongest points that we do is tobacco control. HPV vaccination may be another area of advocacy. Antimicrobial resistance is a third new area that we have picked up. Then the second platform of work is convening, and we convene some of the best meetings. Two of our flagship meetings are the World Cancer Congress once every 2 years, and the World Cancer Leaders Summit, which is again now once every 2 years, where we bring together on stage world leaders. We try to focus on particular regions, get them together, thrash out issues which are relevant to that area, and try to make a policy and then leave with the policy makers, NGOs, civil society, governments, putting those policies in place for the betterment of people in that area. And the last is capacity building. Capacity building, again, in terms of cancer control, we have some very strong fellowship programs. We have a young leaders program. We have CEOs program. Again, to train people, give them the skill set, give them the bandwidth so that they, in their own spheres, can do work. But today is a very important day for me in both my profiles as president of the UICC as well as a head and neck surgeon. I'm currently director of oncology at the Apollo hospitals, predominantly based in Navi Mumbai. I also come to Ahmedabad once in a way. I'm in Delhi very often. Wherever my skill set is required, I'm there to treat patients. But it's important from both aspects because as a head and neck surgeon, all cancers, 90% of what I treat is primarily because of tobacco. And it's very important in our country. Head and neck cancers are responsible for close to 25 to 30% of all cancers in our country, as opposed to 4 to 5% in the West. So it's truly an Indian cancer. And it is because in our country, tobacco is accepted as a socially accepted norm. Everybody uses tobacco. At the last global adult tobacco survey, close to 40% of people in our country use tobacco in some form or the other. Monday is World No Tobacco Day. And WHO calls this a day every year to raise awareness. And every year the theme changes. This year the theme is commit to quit. That means we must get people to quit the habit. And as I tweeted a couple of days back, if each of us can influence just one member in our zone, in our office, in our families, in our social circles, I think it will have a ripple effect and we'll be able to make some impact on tobacco and tobacco control. Close to 40% of all cancers are preventable, and more than half of them are because of tobacco, not only in our country but globally. So this is a very important, strong message that I have to give whoever is listening. In your own little zones, influence people who consume tobacco. Back to you, Shrenik Bhai. I can see your back.
Thank you. Yeah, that was kind of some technical issue. I would like to add uh, one point to what you said. I mean, in line with this quitting tobacco, sir, one thing is very clear that 99% or rather I would say 100% individuals are using smartphone, but we are not becoming smart. We are on the contrary partnering. We are on the contrary partnering the tobacco producers by buying tobacco, and again in turn they are not going to support you in any way once you get diagnosed with the cancer. So it's like we are not enough smart. We are opting for consuming tobacco, inviting cancers. So instead of doing it like that, it's better to quit tobacco. Like that means in other words, we need to be more smart than what we are today. So we must quit tobacco in each and every form.
You know, Shrenik Bhai, I don't know if to respond to this comment of yours, I'm going to make a statement. I hope it's politically not incorrect, but in our countries, tobacco, as I said, is socially accepted. There's a lot of hullabaloo about alcohol. Many states would ban alcohol because a section of society would overdrink, they're not responsible, families would get ruined. I'm not commenting on that at all. But tobacco is socially accepted. So you will see young kids who will consume tobacco. You will see young college people who will consume tobacco. You will see young ladies who will consume tobacco. As a head and neck surgeon, I have seen youngsters in their 30s and 40s that we treat. And when I ask them, why did you do this? Many of them says, we understood it is bad, but we didn't know it was so bad. For example, in large parts of Maharashtra, people brush their teeth. They use mushroom. Uh, uh, in the mistaken beliefs that it's good for dental hygiene. They get addicted to it subsequently. So every morning they'll get up, they'll use this dental paste or mushery and various other things to clean their teeth. But even that can give rise to oral cancers. So I think the message for platforms such as yours, for people who are listening, and I know there are a lot of leaders from various NGOs and civil societies who are listening in today. My message to you all is that we need to take this message to the people. Most people have self-preservation instincts, and if you tell them properly, make them understand the impact and the implications of tobacco use, I'm sure a large number of people will quit the habit. It's important to remember that tobacco in any form or any quantity can be disastrous. Many people feel कि I'll only eat 2 pans a day. मैं 2 पुड़िया खाऊंगा दिन में पान मसाला का, or I'll only smoke after meals. But trust me, even those people are susceptible. And who is susceptible and who is not susceptible, medical science cannot predict. If you are susceptible, you can smoke 2 cigarettes a day and you can come back with a cancer.
Sir, I would like to add one more point to what you said. The people who are unable to quit tobacco, sir, I would like to take a lead that these people must be advised to watch the kidney cancer patients who are undergoing the cancer surgery. Once they will see these patients, that condition with the pipes and cuts and so many things, and the pain they are experiencing. Believe me, we probably we need not have to explain, or rather we need not have to show them any kind of poster to quit tobacco, simply by seeing those patients in IPD. They will realize that where exactly they are driving to while consuming the tobacco. So this could be one suggestion. And sort of one with your permission, I would like to mention that quitting tobacco in 2021, or rather at the start of the decade, that is the best free gift to the family, to the spouse, and to the kid. And this is precious gift. I mean, where you are not spending of anything. On the contrary, you are saving lot of money by not buying tobacco.
Absolutely. So your point is very well taken to get people to get scared. Let them see head and neck cancer patients. So one of the main ways of quitting, or one of the main motivations to quit, is when a person gets cold turkey. That means they get scared. So there will be an event in their life that will scare them. Either someone in the family gets a cancer, or someone in the family gets a heart attack, or they themselves might have some problem of tobacco smoke, like severe bronchitis that needs to be hospital. They get scared and they quit the habit. Scaring people has been used in the form of packaging on cigarettes and gutka, where we show patients with big tumors to scare people to not to use. It does have an impact and does decrease the amount of tobacco consumption. But the single most important cost efficient method of decreasing tobacco consumption is raising taxes. If you raise taxes, the tobacco product, which is slightly cheap, is out of reach of the common man. So South Africa and France were able to cut down tobacco consumption by raising taxes in one third the time that the US took to cut down tobacco. The state of California and the US raised taxes compared to the rest of US. Tobacco consumption in California was less than the rest of US. It's very well proven. Now let us look at our country. If we have 40% of people who use tobacco, about 10% use smoking of tobacco, about 20% of males chew tobacco. Now, whenever we have our budget presented, our finance minister presents, they'll always raise the price of cigarettes. But remember that 20% of our people chew. Of the people who smoke, again 40 to 50% smoke BD, which is cheap. The thing that it is easily available gets them to smoke. It's easy. You can buy it at every street corner, and it costs 1 rupee, 2 rupees, 5 rupees, which is affordable to people. So again, for leaders who are listening to us, civil society, NGOs who can influence, the product should not be easily available, and it should not be comfortably priced. Now, remember, I'll take you back and I'll tell you that Pan was in our culture for decades and years and centuries. Suddenly, why did we get this boom in oral cancer in the last 10, 15, 20, 30 years? Because of the pan masalas. Now, if you needed to eat a pan, you needed to go out to a kiosk to procure a pan. But if you had the pan masala packet in your pocket, you can eat it anywhere. I've seen doctors eating it in the operating rooms between cases. I've seen people eating it at the airports. I've seen people eating it at the restaurants. They're eating it at their home. They may not be allowed to smoke, but they're putting this thing in their mouth because it's easily available. And this easy availability is what has ruined millions and millions of people. And I think there should be some effort to decrease consumption of these products, the lower price products.
I sort of totally agree. But here again, unless people, just like COVID or other pandemic, unless people don't realize the impact, I mean, whether price is lower down or right, unless we don't value ourselves, the complications and sort of what we are going through, I mean, things will be difficult to change. I mean, we can keep on talking, we can showing the posters, everything, but unless one don't feel or unless one don't experience this difficult situation, things are rather difficult to change. Sir, I would like to give one small example of my son. This is my 24th year. When I was diagnosed, it was in a last stage, right? And believe me, I have never consumed any kind of tobacco all my life. I have never smoked, and fortunately, that is also one of the key reasons that I am not having, with the God, with the grace of God, a recurrent cancer. Of course, the surgery performed by Dr. Carcinomas, that was magnificent, spectacular. But here again, not consuming tobacco in any form, that is also kind of an additional advantage.
Yes, absolutely. So I will quickly respond to no tobacco in two forms, in two replies. One, of all head and neck cancers that occur, 90% occur because of tobacco use. We get 5 to 10% who do not consume tobacco, and there are other factors in them, but the vast majority is because of tobacco consumption. Your second point is all the more important. If you continue to consume after cure of your cancer, the probability of getting a recurrence or what we call a second primary cancer anywhere else in areas that are exposed to the tobacco carcinogen is very high. Uh, the second primary cancers occur at the rate of 1 to 2% of year of all cured patients. 15 to 25% of them get a second primary cancer, and it's more common among people who continue their habit. We seem to be losing Shrenik again.
Yeah, so due to this recent cyclone, things are getting
They,
with the internet issue. But I mean,
yeah, but in
am
between,
I?
if we, yeah, if in between, if we are using you, uh, if Ravi can read out any questions in the chat box, I'd be very, very happy to answer them.
Yeah, yeah. I will ask Ravi as well.
Yeah, so go ahead, Shrenik, I can hear you. If there's anything you would like to ask me, I'll be delighted to answer.
Sir, please do enlighten us. Like using tobacco along with the alcohol, how bad it is, or how it is more dangerous for navigated and neck cancers.
Yeah, so your point again is a very, very important point. Tobacco is very, very harmful and very carcinogenic. I'm not going to give you uh, what we call relative risk and things like that, because that would probably be a little too scientific for general public who are listening to us today. But it is the most potent carcinogen for cancers of the upper aerodigestive tract. Upper aerodigestive tract means when you start consuming tobacco from your lips all the way down to your lungs are exposed to the carcinogen. If you smoke, a part of these products are absorbed in the blood and can also cause cancers at distant sites. To give you an example, it can even cause a cancer of the urinary bladder. This month of May is known as Bladder Cancer Awareness Month, and it coincides with World Tobacco Day. Now, whoever thought that if they smoke, they would be prone to cancers of the urinary bladder, certain cancers of the gastrointestinal tract, uterine cancers, breast, various others are linked to tobacco use. Now, apart from tobacco, alcohol is also a carcinogen. So, in people who take both tobacco and alcohol, the effect is not an addition of the risk factors. So, I'll put it simply. Supposing the chances of getting cancer when you use tobacco is X percent, the chances of getting cancer when you use alcohol is Y percent. When you do both, it is not X plus Y, it is X multiplied by Y. The carcinogenic effects of tobacco become much more potentiated among those who take alcohol. So, my message to those listening, consuming these two habits together is 1,000 times more lethal than any one habit. But that does not exonerate anybody by leaving one and continuing the other. Both are known to be carcinogenic and both do not have a safe limit as of today's research to us as doctors to endorse any form of tobacco or alcohol consumption.
Thank you, sir, for very insightful information. Sir, please also enlighten us about the role of oncologists across India, like how they can educate and caregivers when them when they are seeing them during OPD.
No, so I didn't really get your question. You want me to recommend top oncologists or
No, no, sir. What steps the oncology should take, while seeing the cancer patients, head cancer patients and caregivers, like best they can guide them to quit the tobacco use of tobacco.
yeah, so the top oncologists should take among people who are tobacco users. I'm not sure I've
No,
understood. Yeah.
sir, like I want the oncologists and other all kind of oncologists they should educate along with the counseling and everything. They should
Oh,
also
so
educate to some extent.
so so
Yeah.
let me tell you that everybody leaves it on oncologists. People come to oncologists when they have most probably a cancer. I want to give this message to everybody. Everybody has a role to play in tobacco, in decreasing tobacco consumption. All doctors have a role to play in diagnosing early cancers and in diagnosing pre-malignant lesions. So to give you an example, one of the most important groups to diagnose early oral cancers, in my opinion, are the dentists. Most of us go to dentists very often. We have teeth problem, we go for scaling, we have caries. A dentist, when he looks into the mouth of anybody who's a consuming tobacco, will at once pick up an early lesion. But I'm going to give a message to people who are listening to us today. You see, the mouth is a mirror of your entire upper aerodigestive tract. The lining of our mouth should be a healthy pink color. The moment you're a tobacco user and the lining of your mouth changes color and you get white or red patches, you get a growth or an ulcer that persists for more than 4 weeks, please go and see your oncologist. It's an early warning sign of cancer. And if it is, your doctor can treat you with 100% success rate and not much change in function and cosmetic outcomes than if you come with the stage 4 cancer. So my message is everybody has a role. It's not only the oncologist, it's all doctors, it's dentists, and it's lay public themselves who can look at their mouth and orally self-examine and go for specialized care if they feel any concern.
Thank you, sir. I'm quite aware that you are having a huge experience in treating the patients with the recurrent cancer, and that's kind of a palliative treatment. So kindly give us some more information about this so that we can, I mean, through this platform we can give more support, more hope to the patients who are having a issue of the recurrent cancer.
Given my position and my seniority, a lot of patients come to me after they get a recurrence. They are treated elsewhere. So they come out of desperation. People tell them, Bombay jao, Dr. D'Cruz dekhenge, and he will do. So my first message is try to prevent a recurrence. So for all people who direct patients, please choose your doctor very, very correctly. Please go to a specialist in the field. Today, medical science has progressed tremendously. You do not. So, if you have a head and neck cancer, please find out who is a head and neck cancer specialist and go to that person in your city. If you have a breast cancer, find out who is a breast cancer specialist. If you have a lung cancer, so the days of people who did everything has gone. Medical science has shown that if you go to a specialist in your field, so you don't have to go to an oncologist, you have to go to a head and neck oncologist. And I think that is the first message that I want to give everybody. Choose your doctor correctly. What happens when you want to buy a car in your house? What happens when you want to buy another flat for yourself to live your home? What happens when you want to buy your TV or your fridge? You will go through 20 companies. You'll see every aspect, whether the door opens, what's the color, what's the cushion, whether it's Bluetooth compatible or no. Why don't you spend and do little research in choosing your doctor? Please choose your doctor the same way as you would choose other items that come in your life. Now, if God forbid you have a recurrence, some percentage of patients can still be treated with cure. And in these patients, surgery probably is the best form. Really, it's very difficult to generalize the treatment, but we still try to cure patients. So, of patients who come with recurrence, there are various factors that we look. We try to cure anywhere between 1/4 to 1/2 of patients with strong cancer directed treatment. If we cannot do that, then we treat patients for palliation. And the two commonest forms of palliation are radiotherapy. It's given to arrest the growth or cause relief in pain or stop bleeding of a fungating tumor. If the patient cannot take that, we give the patient chemotherapy, and chemotherapy palliates the patient. You need to support your patients symptomatically with advanced recurrent head and neck cancers who are not curable. You need to support their nutrition. It's always difficult for them to swallow. So we put in a tube to help them to swallow. They have pain. So we give them appropriate pain medication and various other aspects of support, such as tummy upset, constipation, foul smell from the growth by frequent dressings. But I think most importantly, patients and their family need emotional and psychological support. So whenever there is a patient, again, many caregivers listening to us, many NGOs that help patients, if you have a patient with a recurrent tumor, even if your doctor is going with cure as an aim, some form of palliative care specialist should be involved in the care. And instituting a palliative care specialist early in the treatment of advanced cancers has shown by research to be much beneficial to patients. They have better physical subsiding of symptoms, better mental satisfaction, and many of them complete their treatment much better.
Thank you, sir. Sir, I still have two more questions to be addressed. You are very well connected with the government agency, and again, being when UICC points are required to be addressed. Number one, we need to have a more number of oncologists in India. Having a huge population, so more and more medical things being made available across, so people can choose more and do more into oncology.
Sure.
That's number one. And by doing so, if this facility we extended, if this facility can be extended, that can be more facilities available in oncology field.
So I
From a smaller they not have to come all the way to, yeah.
Yeah. So again, your point is very, very good. It's very relevant. Uh, on their part, I think successive governments have made attempts to increase healthcare facilities across the country. So we are having more and more medical colleges that are opening up. We've got aims like institutions that are opening up. We've got new and new hospitals that are opening up. We've got a lot of corporate hospitals that are also opening up. Government has raised the number of postgraduate and MBBS seats. So I think there are efforts to improve the critical mass of health personnel that we have who would be able to treat patients in our country who don't have access to good care. But I want to make two or three important points. While we do need people, we also need quality. So just increasing the number of seats, getting people, many patients are treated, which I see by proper allopathic doctors, general surgeons treating cancer, general ENTs not specialized treating cancer, general oncologists treating an area where they are not very conversant with. So I think we need to have more quality control in our efforts, but also I must say that government is making efforts. But more important, we need to strengthen our primary health care system. Just taking vertical silos of centers of excellence is not going to solve the problem. So even if I have a big corporate hospital or a big quaternary care specialty in a village, but if patients come with advanced cancer, the success rate of treatment will still be 20 to 50% in head and neck. If they come with lung and others, they won't live more. So we need to strengthen also our primary healthcare system. So yes, we need to have more access, more centers, more doctors. But to me, my message to whoever is listening and can influence policymakers, emphasis on quality. The second important point, Shrenik Bhai, is that we have centers, but people cannot afford the drugs. People cannot afford the treatment. Now, I worked at Tata Hospital, which is very generously funded by Government of India. People wait for 4 to 6 weeks to get a bed in the hospital. In 6 weeks, the cancer would have grown, decreasing survival. We prescribe a lot of treatment for our patients in government hospitals, but patients can't afford the chemotherapy that is required. In fact, cancers such as pediatric, certain blood cancers such as lymphoma, all these cancers today, testicular cancers, have a very good success for cure, but the equity, the access is lacking among our patients. So we must need to improve the number of doctors, we must need to improve the number of healthcare facilities, but we should also make it accessible to our people. It is very, very difficult. These centers have to come in places where people will have access to care.
And I believe that you were kind enough to cover most of the points which are important for the public in general. If you like to add some more important points and like driving the people to commit tobacco, please give us
So,
some more. Yeah.
So I'm going to end with three important messages. One, tobacco in any form or any quantity is deleterious. So there's absolutely a no to tobacco. My second message, usually people take to tobacco before the age of 20-25. So those of y'all who have children, nieces, nephews, who have youngsters employed in your factories, in your homes, if you can keep them away from tobacco till 20-25, college going students, those of y'all in NGOs who work in tobacco, go and talk at that age. If they don't start, they will not start. 90% of people who start have started before the age of 25. So please focus your efforts on that. And the third message, among those who are taking tobacco, if each one of us, which I said in the beginning, only influences people in our own family, our own offices, our own home, our own workers, our own relatives, I think we'll make a great impact. Programs like this are to inspire people listening, to galvanize action so that they can go out and do this. Everybody only wakes up on World No Tobacco Day. You know, there's a saying that if you look at cigarette consumption is very low in January because everybody on 31st of December says 1st of January I'm going to stop New Year. And then in February, the sales again increase high. So we need to sustain our efforts. And that is my message to all of you all, that be no form of tobacco, concentrate on youth so that they don't start the habit. And if you want people to kick the habit, Work within your own zones, your own family, people who directly you have influence on. That's all the message I want to give today. And Shrenik, it's been wonderful as always talking to you.
Thank you, sir. With your kind permission, I would like to add one more point to
Sure.
what you said. Sir, people who are consuming tobacco, if they get realize that passive smoking or passive effect to the spouse, to the kids by consuming tobacco in a various form, they are rather influencing their health at least in a multiple times. So, I mean, at times people are not much concerned about their own health, but when you involve their spouse, kids into the scenario, probably there could be a good chance of reducing the use of tobacco or rather quitting tobacco.
Absolutely. I totally agree with you, Shrenik Bhai. Absolutely.
All right. So, sir, thank you so very much for your much most valuable insight, giving us a valuable time and everything. And once again, I would like to go down for all your timeless amount, like anything. I mean, you
Uh, uh,
were, I mean, too graceful to give me all somewhat. I would say this is a rarest of the rare somewhat I am getting from you, sir.
no, thank you, Shrenik Bhai, and God bless you for the wonderful work that you do. You inspire many people. One of them is me. And I just hope God gives you more strength, more longer life to take this lovely message to every corner of our country. God bless you. Thank you for having me on the show.
Thank you so much, sir. Have
Thank
a great day. Bye bye.